Hello, everyone, and welcome back to the Shoulders Up podcast, where we break down complex headaches and dizziness. I have a very special guest today. His name is Isaac Ross, and he is the founder and CEO of Haven Headache and Migraine Center, which is a virtual provider group transforming migraine care through faster outcomes and a superior patient experience. His passion is largely driven by lived experience, having been diagnosed with migraine at just 2 years old. With extensive experience in the tech industry, Isaac and Haven leverage technology for better patient outcomes through telemedicine, remote monitoring, artificial intelligence, and innovation. And before we get started with Isaac in here, I just want to say how I met him. I met him at a national advocacy event called Headache on the Hill. So we actually met in DC when we were meeting with lawmakers to advocate for better headache legislation in the countries. Hi, Isaac. How are you doing?
Good. How are you? Excited to be here.
Yeah, I'm really glad we made the connection, and I'm super excited to have you here. I think you're doing really, really, really amazing things with Haven Headache. So let's just dive right in. So I've already briefly mentioned how Haven Headache is a virtual first practice, but can you tell us a little more about the story behind Haven? What was your inspiration, and how did you take it all the way from idea conception to now?
That's a great question. I myself have chronic migraine, and this idea really has been swirling around my head since late 2018 when I myself got on CGRP therapies and really thinking back to my own experiences seeking out care. So, while I've had migraine my whole life, and I think folks, particularly who have chronic migraine, know that it kind of goes up and down across your life. And in my late 20s, I was pretty stable with my headaches. But all of a sudden, one day in 2016, I had one of the worst migraines I've had, and of many, and ended up in the ER after not being able to hold down liquids for several hours.
Mm-hmm.
And from that day forward in 2016 till a couple months after getting on Aimovig, I had a migraine every day.
Mm.
And my community neurologist didn't know what to do with me. Was sent to UCSF and Stanford to their headache centers. Even with all the connections I had through my career in health tech, it took me a year to get into one of the two clinics.
Yeah.
While suffering every day, while being kind of on the edge of, going on disability. And I put those two things together and just thought there has to be a better way. There has to be a better way to get folks in who need care faster. There has to be a better way to get these amazing new treatments out into the world. There has to be a better way to keep people with migraine out of the ER. And that's really kind of where Haven was born out of.
I see. Yeah, so I totally understand the frustration you're talking about. I have actually been to Stanford Headache Clinic and UCSF Headache Clinic, as well as USC Headache Clinic, and as well as UCSD Headache Clinic. And, with these major hospital systems, I think you're right. There's really an access problem. There's a lot of bureaucracy in these large, medical systems. So creating something that's a little more nimble, I think that's really, really great and really serves the community well. So when you were seeing the neurologist and you were, kind of in the major throes of your attack, was the physician you were seeing, were they a certified headache specialist, and were you still working through that the whole time?
So the person I was seeing before this event was just a community neurologist, not a headache specialist. That's because all I really needed at that time. I saw a headache specialist when I lived in New York. She got me on Botox. And when I moved to San Francisco, I was like, I can't get into UCSF for 12 months. I gotta just see someone to get this Botox before that 90-day ticking time bomb kind of goes off. And so I just stayed in the community system until that really bad event. And, complex refractory headache, these community physicians are just not prepared to deal with like a headache specialist is.
Yeah. Did you ever do like a DHE hospital admission or?
Oh, yes, I have. Actually, that was one of the things that we did once I got into UCSF before Innovid came out.
I see.
It's a nice little break, I guess.
Yeah. Yeah.
For those of you who don't know what we're talking about, PHE can be used in a hospital setting. General protocol for migraine is 5 days, and it's an amount you would not be ever do unmonitored at home.
Yeah. So just expanding off of that, DHE admissions, for people who don't know, generally speaking, for refractory migraine, very difficult, very stubborn migraine symptoms, and the medication is a strong medication, so you have to be monitored. So you have to be hospitalized during the time, and it's a 1 hour infusion for every 8 hours for about, I think, four to 5 days. So I think Isaac and I have both done that before. It didn't really work for me, but it sounds like for a lot of people, I think it works pretty well. Definitely something to consider if the situation is bad enough. And being a clinician, it was really interesting being on the patient side in the hospital, and the princess treatment was pretty nice, I must say. So so moving on. So we know there's a massive shortage in certified headache medicine specialists in the country. We're talking about as much as one headache specialist per 44,000 migraine patients in the country. So, to me, every single one of these headache physicians, these headache centers, they're really worth their weight in gold. So, but we've kind of touched on it. Most headache centers are a part of large hospital systems or universities. There's a lot of bureaucracy. So what do you think are some advantages of private practice? So how did you organize Haven Headache around the current challenges that migraine patients are facing?
Yeah, I think there's a couple of advantages, but I just want to kind of highlight why these university tertiary systems are kind of like also failing the community in a way.
Yeah.
Not because of the doctors in there, but because those doctors don't have the support they need to support the populations that need their help. They're often the smallest department in a hospital organization with just 2 to 4 doctors on average in a headache center. And they're not going to get specialized technology. They're not going to be able to build specialized tools. And when we were building Haven, we asked key questions of our chief medical officer, Netta Dea, of like, if we were to design the ideal clinic from the ground up, from the clinical perspective and from my perspective as a patient, what does that look like? What technology do we need to support it? What experiences do we need to create in order to best support our patients? And we kind of took things back to first principle. I think, you asked what are the advantages of private clinic. There are a lot, because you can build systems that really just work for you and for your patients. Mm-hmm. Where in a hospital system, the bureaucracy to change like a intake form is crazy.
Yeah.
But the magic of Haven is that we're combining the patient perspective, the clinical perspective, and technology to enable the experiences we want to create. So for instance, we have an intake process that cuts out 20 minutes of your hour-long appointment that's usually spent collecting information from you, the basic past medications, basic things, and you're not able in a typical headache center to get to the deeper conversations about how is this affecting your life? Mm-hmm. What do we need to think about more broadly in terms of lifestyle? Our technology enables the conversations that so many migraine patients actually want to have with their providers. And then after your first appointment with us, we have an incredibly easy to use headache diary. It's just a text message with 1 to 3 questions a day, depending if you had a headache or didn't. And that goes directly into our clinicians' medical records and allows them to have a much deeper conversation with you about what's working and what's not in your follow-up appointments. It allows us to help intervene when you're not doing well, hopefully even sometimes before you message it to us. And it helps us actually tell if your therapies are working or not in a way that you may not be able to track.
Yeah, so sounds like, Haven, one big thing is you have better access to care. The experience is much more streamlined. It's much more focused and creating good experience. I'm sure many people in California might have had this experience, but some of these major hospital systems, they're moving towards this tertiary care model where you can see them for consulting, but they won't actually write you the prescription for your medication. And
Which is
honest,
insane.
it's
Sorry
insane.
to interrupt you.
It's crazy. I mean, I've been through this, and then so the neurologist, headache specialist is recommending a medication. They tell me they can't write it. I have to go to my PCP to ask for the medication. I go to the PCP, and then if it's a specialty medication, then the PCP is reluctant to write it. And then so what I have to do is I have to go find a community neurologist and ask them to write it. So I'm juggling all this between three different doctors, and it sounds like Haven, you don't really have this issue, and it sounds so much more organized. And I will say, so I just onboarded with Haven Headache as well. I was,
Congrats.
yeah, thank you so much. Yeah, I'm glad I met you. I wouldn't have known, and I was being seen at a headache, university affiliated headache center here, and the doctors are good, but it's just so much bureaucracy and it's just so complicated to navigate. And, it took me about 8 months to get in. And then Haven, I got my first scheduled appointment in 1 month. So it's just, we know the sooner you treat, the better our outcomes are going to be. So really cool what you're doing there. So you've had migraine since you were 2 years old. I think that's important to note, because I think a large portion of the population doesn't even realize that children, actually a significant amount of children also have migraine. We have a shortage of headache specialists, and I'd say we have an even bigger shortage of pediatric headache specialists. So, but having had it for such a long time, migraine care has changed a lot since then. So could you tell us a little more about what your treatment was like throughout the years, and what kind of changes did you see, and what impact did it have on your life?
Well, first off, I just want to welcome you as a member of Haven and a patient. Experience is so important, and we are really proud to keep our wait times between 3 and 6 weeks. But that's a great question. I would say I've been extremely lucky and unlucky at the same time with my headache treatment throughout the years. In my lifetime, which sounds insane because migraines have plagued people for, since the dawn of time, basically. And if you don't know, it's an incredibly genetically driven disorder. And probably the only reason why I was diagnosed early is that my mom had migraine and has migraine. And recognize kind of some of the signs early. The underdiagnosis in children is massive, and I believe 10% of kids will have a migraine across boys and girls before the age of 8. And, back then it was abysmal. I was incredibly lucky in that regard. But until I was 5, there were no targeted therapies for migraine for prevention or acute use. And so as a kid, something that sounds barbaric now is I was on opioids.
Really?
A neurologist told my mom to feed me a bottle of Coke through a bottle so that I could get some caffeine before or during a migraine attack. And actually, when the first targeted therapies came out, which were the triptans, the first one being Imitrex, I got on it very early, but because I was managing migraine with opioids, I had to be hospitalized in case I detoxed off of
My
them
gosh.
at the age of 5, which is hilarious. Luckily, I did not have any problems doing that, but from then on was managing my migraines with triptans, along with some of the old school prevention medications, like blood pressure medications. Which, by the way, as a kid, really limit some of your athletic abilities, which sucks. And then, trying a bunch of different things to manage migraine, a drug called Sansert, which was briefly on the market, which was a targeted therapy. Actually, interestingly, a derivative of psychoactive mushroom, but ended up causing fibrosis, which is wild, which I had as a result of taking it.
Like a pulmonary fibrosis, or?
Exactly, pulmonary fibrosis.
Wow.
But it was like for a short period of time in my childhood, I think about 9 months, the only time I was headache free for a period of time. So it's like pluses and minuses to it. And then, going ups and downs a little bit better as a teenager until 16. And, migraines definitely were a big factor, when I was 16. I almost had to drop out of high school for a little bit. I was stubborn and didn't do it. But I was then really lucky again as I was entering the workforce. Botox came out officially as a treatment for migraine prevention. And for a long time, that amazingly managed my migraines until that 2016 event. And then I was sort of lucky again, as we talked about in 2018, when the first CGRP therapies came out. So, these kind of bursts of terrible, but then I'm just lucky enough to be alive at a time where we're finally getting some treatments that are efficacious.
Yeah, sounds like you've definitely had a lot of ups and downs, which I think is pretty normal for a lot of migraine patients.
Yep.
Sometimes it's good, and then sometimes it's bad. And when it's bad, it just feels like it's never going to end. But with the right treatment, it certainly does get better. And the medications are becoming more specific to migraine. I mean, anti-CGRP medications are revolutionary. If only insurance was better about covering it and having less, putting up less obstacles. So that's definitely a big issue. Do you see children at Haven Headache Center?
Not yet.
Not yet.
We do want to. Our systems right now are really built about self-reporting. We want to make sure we're really thinking through how we translate that to kind of the parent-child relationship. But it is on our roadmap, and I'm incredibly passionate about us getting into pediatrics because of my own experiences and background.
Yeah, there's a huge need for pediatric migraine care. And, Isaac and I have already talked about the DHE admission. And, that's something I believe they do in children as well. So, it just goes to show that migraine in children can be very severe. And it's a little different than adults. If us adults, we have long periods of migraine, and we can't work. During that time, if we're taking a leave, someone can cover for us. And then when we go back, we can kind of pick up from where we left off. But that's not how it works in school, right? When you're in school, you miss school, no one's going to make it up for you. It's on you and your family to kind of play catch up. And that's a lot of stress on someone, especially at that age. So that's why I think, pediatric migraine, we really need more funding. We need more pediatric headache specialists. We just need to give these kids better care. They can just enjoy their lives more. So there's still a lot of stigma surrounding migraine, and I would say not just migraine, but all headache disorders. So what are some things you wish the general public understood more about this disorder? Where do you think people have their misconceptions and misunderstandings?
I think there are a couple that really bother me. A lot of this has to do with we historically ignore women's pain. I think that migraine, we're two men with migraine, but we represent 25% of the population.
Yes.
With migraine. And I think it's more commonly associated with women. And it is kind of linked in with the misogyny of, we didn't drop the ICD-10 code, or not 10, I think it might have been 6 back then, of hysteria until 1970 something.
Yeah, it wasn't that long ago.
And I think it really gets looped in, and most people think of it as, oh, she's just anxious. They're just anxious. It's in their head. It is, but it isn't. And I think that we need to disconnect the idea that migraine is at all psychiatric related and controllable just by managing behavior. And that one really, really bothers me, and particularly for clinicians is the top barrier for getting care usually. The other one that really bothers me is it's just a headache. It's not just a headache. It affects literally every system of your body. Your bladder, stomach often will stop working. You often cannot see really many people often are vomiting or nauseous. It's a full body experience, and it affects your behavior hours before and many hours after an individual attack. The third one that really bothers me, which is more perpetuated by the wellness industry, is that there is some root cause out there for your migraines. The root cause for your migraines is your mom or your dad had the wrong genes. There's your root cause. There are very few people where, just managing a vitamin deficiency, just managing a sleep issue, just managing with diet actually works for. And that myth is very dangerous and kind of keeps people away from seeking proper help.
Yeah, absolutely. So kind of building off everything you said, I think I really like what you said about women being dismissed. Women are more likely to develop migraine or headaches or dizziness or vertigo. But I hope it's getting better, but I believe on average, a woman with migraine takes about 7 years to get actually diagnosed. So they're waiting a really long time. And for whatever reason, the more complex their presentation is, the more likely they are to get dismissed, which obviously isn't right. Love what you said about, migraine is a whole body disorder. It's not just, a headache. You can get things like tunnel vision. We hear people reporting, urinary issues, even, right? Having to go to the bathroom more regularly. There's also things like GI upset. There's a subset of migraine called abdominal migraine, more so in children, where the migraine comes with GI upset. Vestibular migraine, where it comes with dizziness and vertigo. And for vestibular migraine, you do not actually have to have a headache in order to be diagnosed with it. And then going to kind of the third point about the wellness industry, and it's true, when it comes to migraine, there's a lot of predatory marketing out there. Migraine is really is a neurochemical disorder. We have good evidence that there's a lot of physiological changes happening in the brain when it happens. So it really isn't purely psychiatric. Depression, anxiety, of course, these things are going to influence your symptoms, but it's not really what's going on the pathophys level. I do conservative care. I work with migraine patients a fair amount, but I know for me, I definitely prefer my migraine patients to be medically managed properly. Well, I always say, if you take the medication, this is more for complex cases, you take the medication and it gets you maybe 50, 60% there. And then with conservative treatment, we're coming in and giving you that extra, 30 to 40% so that you can feel maybe 90, 95%. But we know there is no cure for migraine at this point. So I think we'll start wrapping up, but can you tell us how people can find you? And could you also tell us how all of us could help you build your practice? How do we support Haven Headache?
Well, the best way to support us is to actually become a patient here in California, or go on our website if you're in another state to kind of put in your zip code, and hopefully that helps us tell us where we're needed next. We are hopefully going to be opening up Texas this year, which is super exciting as well. You can sign up to be a patient at havenheadache.com. And if you have any questions, you can find me on all social platforms at Gay with a Headache. The alliteration didn't work, Gay with migraine, so Gay with a Headache. But that's truly the best way to support us is come experience what a different kind of approach built from the ground up looks like for people with migraine and headache disorders.
All right, everybody. So, you heard the man. I'll be sure to link, the website to Haven Headache, as well as Isaac's socials in the show notes. And just wanted to just reaffirm again that I think it's absolutely incredible what you're doing. We're getting better care to our migraine patients, and they can do it all from the comfort of their own home. And I think one thing we have to realize is actually that produces really, really great results. I would say just as good as if you did in-person visits, maybe even better, because migraine, unless you need some procedures or it's a little different, but really I think the biggest problem we have in migraine care is access, for sure.
One thing I forgot to add is we still have in-person procedures in LA, Orange County, San Diego, and San Francisco. So just because we're starting online, we can still get a needle in your forehead.
Yeah. Yeah. Get in for some Botox, 31 injections. Good time.
Yeah.
Okay, so I would think I will end it there. If you enjoyed listening to this episode, please consider giving it a 5-star rating. It really helps to grow the channel. And feel free to share this episode with anybody you know who you think could benefit from specialized headache care, who's running into a lot of issues with major hospital symptoms and just dealing with a lot of bureaucracy. Haven Headache is a great place to go. I recommend them to several of my patients now. They really do a good job of getting the care that patients need.